Welcome to Valley Fever Voices. I have Dr. Jared Jaffey here today to share his wealth of knowledge about valley fever and the work he's done to help us get a faster diagnosis for this horrible fungal disease, improving the prognosis for people and pets that contract valley fever. Thanks for joining me, Dr. Jaffey.
My pleasure. My pleasure. Glad to be here.
Dr. Jared Jaffey is originally from South Florida. He's a board certified small animal internist and associate professor at Midwestern University College of Veterinary Medicine. He teaches vet students, sees patients, and performs research at MWU. His research focuses on infectious diseases, including valley fever, as well as endocrinology, respiratory diseases, hepatobiliary disorders, hereditary syndromes, and immunology. He has published over 70 journal articles and contributed to many leading veterinary internal medicine textbooks. All right, Dr. Jaffey. The first thing I want to know about is what do you do at MWU? Like what are your responsibilities, and does valley fever come up while you're teaching or in research?
Yeah, great question. My responsibilities at Midwestern as an internist is kind of threefold. So I have my responsibilities on clinical duty, where I will see cases along with house officers like interns and students. And then I also have responsibilities for teaching. So not only with students with clinical cases in the hospital, but also didactic lectures across our street in our auditorium. And then lastly, one of my favorite aspects is research. And so it's kind of the threefold pillar for me is a big reason, why I wanted to be in academia was to be able to teach, still see cases, and perform research. And so valley fever, for me, it has come up and has, ended up being a big part of my life in a lot of different ways, because it's so prevalent here.
Mhm.
And so, initially when I first came here in 2018 after I finished my residency, it was something that I didn't have much familiarity with at all. Like I had to study it for my boards. I had maybe had one slide about it in vet school because I went to vet school out in Florida. So I didn't
Yep.
really have a ton of background with it, but being at this level of care and getting a lot of referrals for these types of cases, you have to learn pretty quickly about a disorder like that that's so prevalent. And so it was something that drew my interest because I do like infectious diseases, and it was something that I started seeing more and more. And so as a researcher, you always want to try to pick a topic of research that not only interests you, but also something where you have typically a plentiful supply of participants to do that work with.
And probably
It's
a lot of unknowns.
yeah, and also lots of unknowns. And so it's tough when you pick a disorder that you want to research, and then it's really difficult to find pets that have that disorder you want to look into. So that wasn't an issue here. So it turned out, valley fever was really prevalent, especially in dogs, not as much in cats. And so it was something that, has come up more and more over time for me. And as I've established myself over the last 7 years as being a person that has a lot of clinical experience with the disease and has published quite a bit on the disease, I think I'm getting more and more referrals for that. And a lot of our students stay local, and they know that I really like valley fever, and so they end up sending me a lot of cases as well. So I think proportionally, valley fever has now you probably consumed a larger proportion of my caseload when I'm on clinics than it did initially, which I enjoy. I really like those tough cases, and it's nice when you can provide insight and help when something isn't going as expected, and you can really make a difference. So I enjoy it.
Nice. Yeah, and it's nice that you're teaching the students about it because we need more vets that are competent and aware of valley fever so we can get our dogs and cats diagnosed quickly and
Yeah.
get them help.
Exactly.
instead of getting to the point where it's severe and they end up at the university. Yeah. So you were involved in the studying a new rapid valley fever test. Can you tell us what makes that different from the traditional diagnostic techniques?
Yeah, absolutely. So, the traditional diagnostic technique that most people probably know about are valley fever titers or coccidioides titers. And so,
Hmm.
the methodology used for that most labs utilize is agar-gel immunodiffusion or AGID. And so that is the most common test that's done in vet med. There also is another test that also looks for antibodies, but only IgG antibodies, whereas the AGID immunodiffusion test looks for both IgM and IgG. Is a test that's only offered by Mira Vista Diagnostics, and that's called an EIA or enzyme immunoassay. So it's a different methodology that uses slightly different antigens to detect slightly different IgGs than what you're going to get with your classic coccidioides immunodiffusion test that all of our labs typically use.
So
And
are
so
both of these antibody tests?
yeah, both of these are
Okay.
antibody tests, and they're both very good typically. If you're looking at the immunodiffusion tests, and you're combining both IgM and IgG being positive, at least one of them being positive, the sensitivity to detect a positive case is usually quite high. Usually, like 75 to 80% of cases will have either a positive IgM or IgG when you look at immunodiffusion. And I'd say proportionally, that percentage probably is much higher when you're talking about disseminated disease
Mhm.
compared to pulmonary disease. Um, and then you have your enzyme immunoassay or your EIA that looks for IgG as well. So that test has a similar sensitivity to the IgG, which is in the probably the 70 to 80% range. I do think that they complement each other pretty well. I think that we all have been frustrated with cases where you have a situation where you're pretty convinced that it's going to be a valley fever case and the antibody serology test comes back and it's negative. And
Mhm.
so, there are
They're
multiple reasons for
frustrating.
that. One in particular, when you're talking about pulmonary disease, there's a potential that it might be a little bit too early for the
Mhm.
dog or cat to have seroconverted enough antibodies to be positive on the test. Because remember, your IgM is typically your first class of antibody that's going to be made in the acute phase of the infection, but that typically in a normal course of infection will come and go within a couple of weeks. And then you have your IgG that starts to get made. But there can be a little delay from when you have IgM to when you start making IgG. And so sometimes there's a little bit of a lag. And so you might be in a situation where it's just not enough time to have gotten enough IgG, at least with immunodiffusion. And so there
Hmm.
are some cases where if you have a negative test result with immunodiffusion, but you're really still convinced, like it's a case that's febrile, has big tracheobronchial lymph nodes, and all those things that, and you have a negative immunodiffusion test result, it's still very highly likely to be valley fever given that clinical scenario. And so you can either try retesting in, roughly 30 to 60 days and see if they just needed more time to seroconvert. Or what I really like to do is, in dogs at least, submit the EIA test because I have absolutely found cases where they were negative on immunodiffusion. And then because the EIA uses a completely different methodology and also different capture antigens, you have the ability to maybe complement your diagnostic investigation and improving your sensitivity by pairing your EIA in those cases. Um,
Are
I
you
think
starting treatment when they're negative and then retesting in a month or two?
Yeah, so in that clinical context, if I have a case where my suspicion level is very high for valley fever, but my test was negative, I'm absolutely starting therapy and then either trying to get the owner to submit the EIA IgG if it's a dog, because it's not available in cats, it's only
Hmm.
dogs, and or retesting in 30 to 60 days. And there will still be some cases that they don't have an appropriate humoral response, and so they don't make enough antibodies. I wouldn't say it happens commonly, but you absolutely will have cases that will remain seronegative at the time of diagnosis and throughout the entirety of their
Mhm.
treatment. And it's just the way that that particular pet is. And so
Yep,
you
I've
really
had
have to,
those.
yeah, you have to rely on your context clues of the case, like, tracheobronchial lymphadenopathy and other things to really help cement that suspicion. And so if I have a case I'm suspicious, I'm definitely not withholding treatment. I'm definitely
Yeah.
starting treatment. And then
What
when we talk
about
about the
PCR?
what was
Is there
that?
PCR testing?
So
Think
I'll
about
so
that.
there is I think IDEX does offer PCR testing. I will say that it is essentially useless on whole blood. Um,
Mm,
when you look at the literature in humans, there's been a couple studies that have looked at the utility of PCR to detect organisms, or I guess DNA of the organisms in blood. And it's like less than 2% of cases of people that have valley fever will have positive PCR detection with the
wow.
classic PCR that we're using now. Now, there may be something in the future that's going to be, much more enhanced, but
Yeah.
right now it's not useful at all. So, the labs that are offering PCR on whole blood or fluid samples, they don't really have any literature to really provide saying that it's actually useful. So it's not something that I ever recommend. The only time I will recommend it is if it's let's say, a pulmonary case that's been especially difficult, but I'm really still suspicious that it's valley fever. And I'll do my bronchoscopy and BAL, and I'll submit my BAL fluid for cytology, fungal cultures, and I'll also consider submitting some of that fluid sample for PCR. I think that might have some utility in the literature in humans looking at respiratory secretions, including sputum and bronchoalveolar lavage fluid, is decent. And so I think there sometimes are cases where it's difficult to make a diagnosis when you rely on antibody serology, especially in pulmonary cases, that using PCR in the right context might be useful. And a CSF is another possibility. That's something that we're going to look into in the near future, is the sensitivity and specificity of PCR to detect DNA of cocci in CSF from dogs with CNS cocci. But when we talk
Nice.
about the
Do you think do you think we should be doing more of the bronchoalveolar lavage and the cultures?
Yeah, I don't think that it's really necessary in most of our cases, because um usually most cases, when you talk about your clinical history, your physical exam, your radiograph findings, and your minimum database combined with your antibody serology, most of those cases you don't end up needing to do more expensive invasive diagnostics like that.
Mm,
I will
okay.
say that I personally do see cases that have refractory respiratory tract signs that have remained negative on multiple different types of antibody serology, different labs. And we end up going down that road, and we then end up doing fungal culture cytologies and things like that, and we can catch some of those cases. But I think the overwhelming majority of cases, you don't end up needing to do that.
Good. Wonderful.
And
Um,
I did get sidetracked. Sorry, I do that sometimes. But your original question, which I have digressed quite a bit, but your original question
it's all
included,
about testing. It's
yeah,
good.
yeah, the point of care testing. And so the main test I think that most clinicians are aware of is the IMMY test, the
Uh-huh.
IMMY. So that's a point of care test that uses a very, very small volume of serum, or technically CSF. We're also looking at that too. But technically, most people are using serum, 10 microliters, which is a really small volume. That is something that can be performed out in general practice. It is FDA approved for use in humans. It's not approved yet for use in dogs and cats. There are a couple studies in dogs that have looked at the agreement and positive results with the IMMY test with your standard immunodiffusion testing. And so in those contexts, there has been good agreement, meaning that if the standard immunodiffusion test said that it was positive, then generally speaking, the point of care test, the IMI test was positive. If the immunodiffusion test was negative, then generally speaking, the IMI test was negative as well. And so, but no one has actually looked at the utility of that test at the time of diagnosis to help with actually achieving a diagnosis. In people, the sensitivity of that test to make a diagnosis is actually pretty poor in people. And so that was the motivation for the study that we're nearing completion was what is the utility of this point of care test and helping to make a diagnosis in dogs that are suspected to have pulmonary valley fever. And so that test is a point of care test. So you get results within 30 to 60 minutes, which is a huge advantage. It is essentially a proprietary mixture of antigens that are going to detect a mixture of both IgM and IgG antibodies. It does not allow any type of distinction between IgM or IgG. It just says, is there presence beyond a certain threshold of IgM and or IgG? So there's a color change, like a blue line that'll pop up that's positive.
Like a
And
pregnancy test.
Yep, exactly. Like a pregnancy test, or I think a lot of clinicians are familiar with like a SNAP
Your heart.
CPL test or something
Yeah.
like that, where there's a color change, or a 40X, SNAP plus test, And so it's a color change. And so there are advantages to it in that it's very rapid, which is compared to our immunodiffusion test. A lot of labs, sometimes can take 5 to 7 days to give you a final result of what a titer is. Some labs are good about telling you if it's positive within a couple days, but then it's still you need more time to actually get the actual titer result. Now, the EIA in dogs with Mira Vista, you typically get those results within 48 hours, so that is a little bit faster. But how can you compete with a test that tells you results within 30 to 60 minutes? So
Right.
there is an advantage to that, especially in those cases that come in that are severely affected, like those dogs that can come in respiratory distress that are oxygen dependent. They have a diffuse miliary pattern on their radiographs, and you're like, oh my gosh, is this cancer?
Yeah.
Is this valley fever? And you're trying to get something in the moment that can help kind of guide clinical decisions. So I
Yeah.
do think that it has some pros to that. I do think, though, that it's really important for clinicians to understand its limitations. So like I just mentioned, it doesn't tell you whether there's IgM antibodies. It doesn't tell you whether there's IgG antibodies, and it doesn't tell you an actual titer result. And each of those things can provide a lot of useful information. If I know that a dog is IgM positive, the likelihood of clinical disease in that dog being a result of valley fever goes much higher for me if the IgM is positive. And with IgG, we all know that a lot of pets and people in this region have been exposed and have had some type of antibody positivity. All right. And so knowing the magnitude of IgG positivity can help you contextually understand, is valley fever the true cause for symptoms in that patient, or are they not the cause? If I have a patient that comes in with acute respiratory tract signs and the IgM is negative and the IgG is 1 to 2 or 1 to 4, it might be valley fever and it may not be. Maybe it is they just got boarded and they ended up picking up kennel cough, and so you have no
Will that
way
cross
to.
react with those tests, the
So
chemical?
the infectious diseases related to canine infectious respiratory disease complex will not cross-react. What I was trying to elucidate was the fact that that dog in that context may have positive antibodies because it was exposed
Oh,
2
an
years
exposure
earlier.
titer.
Yep.
Okay.
And then all of a sudden they come in, someone runs this
Ah,
IMI test and it's positive, and then there is an assumption that that means that that dog the respiratory tract signs were from valley fever, when in fact, that dog probably just has a very weak positive result because of previous exposure and a subclinical infection. So that's the disadvantage of the IMI test, is it doesn't allow you the magnitude of positivity for you as a clinician to understand what the likelihood is that those clinical signs are truly from valley fever. As that magnitude of positivity increases, you're 1 to 8, you're 1 to 16, you're 1 to 32, you're 1 to 64, the likelihood that that clinical picture is from valley fever goes much higher. So there's a disadvantage. And so what I would say, and I'll talk in a second about my research and then study that we did with that. But as long as clinicians are also submitting standard testing, then I think that the IMI point of care test can have value in the clinical setting to provide immediate information. What I worry about is clinicians charging a certain amount for the test and then not being able to then submit standard testing to try to truly understand the clinical picture. And so I worry that clinicians are just submitting the IMI test and making broad sweeping clinical decisions based off of that test alone. And I think that's inappropriate.
Okay. But they have symptoms. The pet would have symptoms when they would be testing. I would imagine it's not a a preventative kind of a test.
Sure,
The
but
pet
let
would
me,
have symptoms consistent with valley fever, and then they would do the IMI test and get a positive result and then go on to treatment. And a lot of pet owners maybe can't afford to even go on with more expensive testing. So I can see where you would be worried about the follow-up.
yeah, and that's my major concern. Like, I'll give you another example. A dog that comes in with acute lameness and of the back hind limb, and the owner can't afford to do radiographs, and so they'll do CBC chemistry, and they'll be like, "Let me do this IMI test to look for antibodies," and the
Uh,
IMI test comes back and it's positive. There then is an assumption that that dog has valley fever osteomyelitis. They start fluconazole or an azole. They'll start an NSAID or something like that. The dog will get better. And then there is this reaffirmation that, oh, the dog got better on fluconazole. It had to be valley fever, when in fact, that dog probably just had exposure to valley fever at some point in his life, had antibodies circulating in its system. The IMI test was positive, but the reason for that dog's lameness was a cruciate tear. And the NSAID is actually the thing that made the dog feel better,
uh,
and not the fluconazole at all. So that's just another one of many examples I could come up with, where if you rely on the IMI test in a vacuum, you could really make a really bad detriment to the patient. So I think that if clinicians are going to do the IMI test, they have to submit standard testing to help contextualize the clinical picture more. You cannot rely just on the IMI test to make these types of clinical decisions.
yeah. So you do the IMI test like in an urgent care
Yep,
situation,
exactly.
and then the pet would go see their regular veterinarian and have the titer done.
Absolutely. Or a lot of urgent care vets or emergency clinics have the ability to send off the standard immunodiffusion at that visit. So they come in with acute lameness, they run lab work, they run the IMI test to get immediate results if they want to in that case. But they also send off standard immunodiffusion testing to whatever lab they use, IDEX, Antec, Prototech, Zoetis, whoever. And then they can call the owner and go over the results or forward them to the primary care veterinarian. Or the primary care veterinarian is the one doing the IMI test in the acute setting, and then
Mhm.
also sending off standard antibody serology testing. So I
Yeah.
do think that that is essential for clinicians to understand, that you cannot just run the IMI test. That I think that that is really inappropriate to make broad sweeping long-term clinical decision making based off of the IMI test results in a vacuum.
Yeah. So in endemic areas like Arizona, are you recommending routine screening of pets without symptoms, like
Not
on
at
an
all.
annual basis? No.
No, not at all. So, Lisa Schubitz, she published a study, almost 20 years ago now in JAVMA, where she did a seroprevalence study in Pima and Maricopa County to look at the prevalence of antibodies or in dogs with valley fever. Granted that most of them were young, but there was an overall 8% prevalence in roughly 300 dogs that were screened. So any clinics in the area, it was about 8% of dogs. And what I found really interesting in that was that there were several dogs in that study that were completely subclinical. They had no issues whatsoever, and they had titers as high as 1 to 16. And so
Wow.
you're not going to necessarily whip out treatment and start azoles on a dog that is subclinical. There's no reason to do that unless you have a clinical suspicion that there's active disease going on. And in human medicine, there's a lot less reliance on antibody serology in diagnosing and in treatment response.
Yeah.
And so it's something that should not be done just like random annual screening and then including titers. Because I think that you can run into situations like that where veterinarians will have this wellness exam come in, a titer will come back at 1 to 8, and they're like, well, like I guess I should maybe treat even though this pet is completely subclinical. And I do think that's something that I would not do.
So our titers um, do not match our symptoms. So we can have no symptoms or no disease and have a titer, or we
Yeah,
can have
so
severe disease and have a very low or negative titer. It can be all over the board.
it can be all over the place, and that is one of the many downsides of not having a reliable antigen test like, histo, blasto, crypto, asper. There are reliable antigen tests that have a really high sensitivity for active clinical infection. We don't have that for cocci, and so we're reliant on antibody serology, and so it does muddy the waters. And so, it absolutely is definitely something where I would not advise just including valley fever titers on standard wellness exam lab work if a patient isn't clinical.
Are there people trying to get antigen testing for valley fever like we have for histo?
So Mira Vista does have an antigen test. The problem is the sensitivity is roughly 30%. And so
Oh, wow.
you miss 70% of cases that
Yeah.
truly have valley fever. So it's there, and I do reach for it in cases, for example, that I'm convinced might have valley fever, but I cannot get a positive on any of my antibody serology tests. I may consider doing antigen testing on that because the specificity is quite high. So if it's positive, it's positive. So I use it sparingly in certain clinical scenarios. I don't know if anyone is currently working on developing a more sensitive cocci antigen test.
That would be nice to put that
Yeah.
on the list of research.
Yeah.
Have you treated other pets um, with valley fever? Like
Uh,
exotic pets or cats or alpacas or all those other?
Yeah, good question. So I try to stay in my lane with dogs and cats. I definitely would not be any use to any other species, but with cats, yes. It happens a fraction of the time in cats, but it absolutely does happen. Even in cats where owners swear that they are indoor only cats, it absolutely happens in them.
In the air.
Yep. And so whether that's because owners can bring in spores on their clothes or they keep, the windows open or whatever it is, indoor only cats absolutely get valley fever. So you can't look at that in the history and say, I'm not even going to consider valley fever in this cat because the owner swears that they're indoor only. You cannot do that. So I
Right.
absolutely will treat cats as well and dogs. Alpacas are interestingly really highly susceptible.
Yeah.
Whereas horses essentially have the same exposure, but they almost never get infected. So
Well, it seems like they get diagnosed after they die. Like horses can get it,
they
but
absolutely get it, but it's really
yeah,
rare. It's really rare.
yeah. So that's a tough one. Do you have any cases that particularly stood out with your valley fever patients?
Yeah, I mean there's always, some that stand out more than others. I'd say that I had this one case, Wally, a few years ago that had presented for evaluation of this non-healing draining tract wound in its ventral cervical area. Also had some regurgitation and dysphagia. Um, and so the primary care veterinarian had tried multiple empiric courses of antibiotics. They done some cultures with the some of the fluid that was draining, and sometimes would pick up some bacteria, and it would get a little bit better, but really not get a much better. It would never heal, and so no antibody serology had been performed. And so when we saw Wally, we did some impression smears and we did fungal culture, and we identified that, we grew cocci on the fungal culture. We saw
Wow.
spirals on cytology, and then he was antibody serology positive. And so we wanted to kind of take it a step further there, because just because we knew that that lesion was from valley fever, we didn't know how extensive it was. We didn't know if it was contributing to the dog's regurgitation and the dysphagia. And so we ended up doing a CT and esophagoscopy. And on CT, you could see that there was a granulomatous lesion in the ventral neck. And it also looked like there was a fistulous tract that actually connected to the esophagus. And so when we did our endoscopy, we actually were able to drive the scope in through the fistulous tract and
Oh,
drive
wow.
around and kind of see kind of where it went into these, different cavernous areas. It was really pretty interesting. And then the dog ended up going to surgery to excavate the area and debulk disease, cleaned up the fistulous tract that was there. And then after that, we treated with azoles. And that dog responded beautifully and did really
Nice.
well, and ultimately ended up going into remission at some point. So that, I think that was a really cool case.
Yeah, it's that makes it important to test all these bizarre cases that we have for
Yeah.
valley fever,
Mhm.
before you know, think about all the other things. Valley fever, if you've got a weird case and can't figure it out, test for valley fever.
Yeah, absolutely.
That's so important in endemic areas.
Yeah, totally
Wow.
agree.
Now you're doing a chronic bronchitis study now.
Yep.
You're doing some clinical trials. Is that something that could be applicable to valley fever?
So I'll just tell you a little bit about the study itself, and then maybe how it might apply in the future. And so this particular study, we actually expanded the study to include not only dogs with chronic bronchitis, but also dogs with eosinophilic lung disease. And
Mhm.
so the foundation of treatment for both of those disorders is corticosteroids. And
Yeah,
so prednisone obviously works really well with both of those diseases, but obviously can have a lot of side effects long term. And so most people, to try to circumvent those adverse effects, will use inhaled fluticasone, or Flovent is the name brand. And so in the US, that can be quite expensive. And there is a variable response in dogs that are treated with these inflammatory airway diseases with fluticasone or Flovent. And so in people with chronic bronchitis, they are often treated with a nebulized form of budesonide. And so nebulization of the steroid actually might provide better control, because it's able to, the particles and how they breathe it in might be better distributed for coverage of the mucosal surfaces of the airways versus a metered dose inhaler with the particles. And budesonide itself might work a little bit better. And so no one has actually looked at that in dogs. And so, that's the purpose of the study, the clinical trial, is to determine if dogs with either chronic bronchitis or eosinophilic lung disease, how they respond to nebulized budesonide. And so any
interesting.
dogs that have chronic cough, that have had valley fever titers done, some radiographs done, they are eligible for this investigation to determine if they might be eligible. And so at Midwestern, we have this clinical trial actively going on, and owners will spend $400, and they will get chest rads, they'll get a bronchoscopy, they'll get BAL, they'll get fungal bacterial cultures, mycoplasma cultures, and all the goodies for
Wow.
that.
It's a
And
heck of
so
a
if
deal.
it turns out that we find something that they're not eligible for, then the owners got really lucky. They only had to spend $400 on a
Mhm.
diagnostic investigation that here would probably cost them about $2,500
At
typically.
least.
But if it does turn out that they're eligible for the study, then we would end up prescribing a medical grade nebulizer, and also the budesonide, and they would administer the budesonide once every 12 hours for 14 days. And then they would come back on day 14 or 15 to have a repeat bronchoscopy for us to repeat the BAL so we could determine objectively how it actually helped with the inflammation. The owners also fill out a questionnaire during the course of the 14 days for us to get an idea on how they think their dog is responding to the inhaled budesonide. And so we kind of look at response and outcomes in a kind of a multimodal way. So
Interesting. Are
mhm.
you thinking budesonide, because it works on the GI mucosa, would work on the respiratory
Yeah,
mucosa? Is
and
that
it should. It's
what you're
used in
thinking?
humans in respiratory inflammatory diseases.
That's cool.
Yeah, and so
Really interesting.
yeah, so we're actively enrolling all of those cases. So if any clinicians out there have dogs that have a chronic cough that they think might be chronic bronchitis or eosinophilic lung disease, we can perform an entire workup for pretty cheap for the study.
Nice.
So just contact us if you're
Yep.
interested in potentially enrolling a dog. Now, how this might apply to dogs with valley fever. Um, you know, I think all of us have had valley fever cases, especially pulmonary cases, where initially we will use anti-inflammatory doses of prednisone to
Yeah.
help bridge the gap from when we start antifungals to when they start to respond. And so we can utilize the anti-inflammatory effects of steroids to help them feel better, help the inflammation go down, and help with symptoms. And so I think maybe there is a possibility that in some of these cases, instead of using prednisone in like the first 2 to 3 weeks after diagnosis of pulmonary cases, maybe we could use nebulized budesonide instead to maybe help with mitigating some of that inflammation, causing some of those symptoms temporarily. Maybe
Well,
that's
and
something
it
we're looking at.
probably wouldn't be as immunosuppressant
Yeah,
as the oral prednisone. So
yeah,
it'd be
potentially.
safer in the long run.
Maybe, yeah, that's something that definitely I think would be interesting to look at, at some point in the future.
Wow. All right. Well, how about you did also a study on vitamin D
Mhm.
on um, the immune system. Now, is that something that's important with valley fever also?
Yeah, and so you bring up a really good point, and that's a passion project for me is looking at vitamin D and its immunologic effects in dogs. And so, a lot of people don't realize that vitamin D plays a huge part in protecting the host, especially with mucosal immunity against respiratory tract infections, in a lot of different ways that I don't have enough time to go into. But we did do a study where we looked at vitamin D concentrations in dogs with valley fever. It was a relatively small population. And so when we looked at dogs that had valley fever versus dogs that didn't, the vitamin D concentrations weren't significantly different between the two populations. And in people, I only think there might be one or two studies, one really that I know of, where they looked at vitamin D just very broadly again, people that had valley fever versus people that didn't. Again, a small population, they didn't see a difference in vitamin D concentrations. But what I want to stress is that just because there wasn't necessarily a difference in vitamin D serum concentrations doesn't mean that it may not be an avenue to utilize to increase vitamin D to a certain level to maybe augment the immune response to fight off valley fever and or mitigate the inflammation and the resulting clinical signs that may help them feel better. That's something that might be useful down the line. We have a study in review right now showing that, oral supplementation of vitamin D did have anti-inflammatory effects in a group of healthy dogs. And so that was really exciting. It's
Are
one
you
of the
testing
first.
first? Are you getting levels of vitamin D first and then supplementing?
So in that population, we did get the healthy dogs, we did get vitamin D levels first before we supplemented so that we had a baseline of where we knew that they were. So we can over time show that when we supplemented with oral vitamin D, their vitamin D levels increased. And then we also showed that it also correlated with these anti-inflammatory effects, looking at cytokine concentrations and in some lab experiments that we did.
So that when you increase the vitamin D to a normal healthy level, the inflammation goes down in the body.
So you just brought up a really good point. We don't know what a normal level is, right? And so we know that there might be a reference interval based off of a normal population, but there are very likely specific vitamin D intervals in blood that can be targeted for specific clinical responses. And in people, they have certain targets with like preventing colorectal cancer. We know that we want to have serum vitamin D concentrations in a certain range to be protective against colorectal cancer. In people, they know that they have positive immunologic responses. We want to target having vitamin D in a certain range. We don't know what that is yet in dogs. No one has done that research yet. All we know when you submit vitamin D to a lab like Michigan State or VDI or one of these labs that measures it is they did was survey a bunch of quote unquote healthy dogs and
Oh,
establish
wow.
the reference interval like you would for a hematocrit or an ALT or something like that. So there's probably, a certain target range that we need to look at, which is going to require a lot of research in the future to try to see what that may be in dogs for very specific diseases, whether it's GI disease or a certain immune response. There's a lot of research that needs to go into that.
So is that something you're looking at doing, is researching what our normal values are in dogs?
Yeah, I mean that is definitely something that I want to include in my repertoire is eventually try to,
That'd be good. We need that.
establish certain intervals that are associated with certain diseases. So helping with kidney disease, helping with chronic inflammatory enteropathies, helping with certain anti-inflammatory effects. So this is going to require a lot of research in the future and but that is something I'm very passionate about.
Nice. Wonderful. Now, you also did some research on whole food diets and the effect on the immune system. Um, and can you tell me about that study?
Yeah, that was a really interesting study. I was approached by Just Food for Dogs
Ah,
on trying to look to see if a whole food diet, so one that is comprised of human grade ingredients that are cooked, if it might have anti-inflammatory effects compared to your standard extruded kibble diet that I think a lot of us use in our pets. And so it was a randomized crossover clinical trial where we had a group of healthy dogs that were randomized to either eat their normal kibble diet that they were on, or the whole food diet from Just Food for Dogs for a period of time. And then there was a washout period, and then they crossed over to the opposite food. So if they started off on their kibble diet, they then ended up getting the whole food diet later on. If they started on the whole food diet, they then finished off on the extruded kibble diet that they had been maintained on entering into the study. And so we looked at different immune function parameters at baseline before entering the study, at the end of the first phase after they finished the first block of eating a food, and then at the end of the second phase when they finished eating the second food. And ultimately we did find that the dogs when they ate the whole food there were some changes that were consistent with anti-inflammatory effects. So I think that it's
nice.
a very interesting preliminary study that had somewhat of a crude approach to it, but I think it laid the foundation of formulating some really interesting ideas that some other investigators can then kind of take off and then maybe look at dogs that have certain diseases. Because we used healthy dogs, right? And so, it might actually be a more profound response in dogs that have some degree of inflammation. Like let's say dogs that have osteoarthritis or they have,
For
something else.
valley fever.
Yeah, or valley fever. That, having a food like that, might be useful. I mean, a Mediterranean diet is classically known for having more anti-inflammatory impacts in people compared to your standard Western diet.
Mhm.
And so I think it's very reasonable to suspect that what you put in your body food-wise can absolutely have an impact on your immune system and inflammatory changes. So I think that's also maybe something that we could look at some point with valley fever, looking at that whole food diet.
Yeah. Has that changed? Has that study changed the way you practice at all?
It actually has. I was a little bit skeptical in the beginning because it's, a food company, they're wanting to, try to find something to market their food. But they were very hands off. They said, here's the money, design your study, and we are okay with whatever results that you find. And they had no influence on how I interpreted or presented the results. And so I think that in the process of doing the study, finding the results that I did, and then looking at the literature in humans and also finding, how impactful diet can be in people, it has changed how I've practiced. It is something where I am much more open-minded in a lot of different clinical scenarios and talking about a whole food prepared diet, whether it's just food for dogs or not. There are other companies now that are making whole food diets that are formulated and balanced by veterinary nutritionists, which I think are great, or a home prepared diet, right? Using all like
Yeah.
cooked human ingredients. I absolutely think that there's something to it. And so I think that my trigger for recommending those things is, much more common than it was before.
Yeah. Yeah. I find a lot of my clients are already feeding fresh food. And
Yeah.
so being open-minded about it is important for a vet,
Yeah,
Yeah, especially now
absolutely.
that we have research that shows that it helps.
Yeah, yeah, for sure.
Yeah. Um, is there any advancing research currently or collaborations that you're involved in that are exciting?
Yeah, I can absolutely go over some results that we've worked on recently and maybe talk about some of the current studies that we're enrolling valley fever patients for. And so it's nice that you brought up the IMI point of care test because that is a study that we're kind of at the tail end here of finishing. But the objective of that study was to look at the diagnostic utility of that test in dogs that present with respiratory tract clinical signs. And so we included dogs that ended up having pulmonary valley fever. And we also included dogs that had confirmed other respiratory tract diseases that were not valley fever. And so
Oh,
at the time that they were initially evaluated, we collected serum and we submitted that for our standard testing, which included both immunodiffusion and EIA. And then we also, on that same serum sample, ran the IMI point of care test. And we wanted to say, what is the sensitivity and specificity of this test at the time these dogs are getting worked up? And so we ended up, I think so far we have about 120 dogs with pulmonary valley fever. And we have about 40 dogs that have confirmed other respiratory tract diseases that looked very much like valley fever at the time they were diagnosed. And so in that study, we found that roughly 85% of dogs that had valley fever had a positive result. So it did miss about 15% of cases that truly had pulmonary valley fever, which isn't a big number, but it's a number that is still something that you should look at and say, if I run this test in my practice and it's negative, I can't completely trust the negative. It's not 100%.
right.
15% of dogs may have a false negative. Now, all of those dogs that had a false negative all had either a negative or a very low positive test result. So this was a beautiful aspect of this study, was that we utilized both immunodiffusion and EIA. So we captured some dogs that had a negative immunodiffusion but a positive EIA, or vice versa. And so all of the dogs that had a false negative had either a negative result or a very low positive result. And so it is possible that we can miss some of those cases that have low circulating levels of antibodies. Now, in contrast, the specificity was 100%, meaning that if that test said that there was antibodies there, there were no false positives. It was always there. But recall what we talked about earlier, just because that test result was positive, it doesn't tell you what the magnitude of positivity was of the IgG, and it doesn't tell you what the IgM, whether it's positive or negative. It just says there are antibodies there. And so the test is seemingly amazing at saying that there's antibodies there, but it doesn't tell you some other really important information. So I think that, going back to what we talked about earlier, I think in an immediate setting where you're trying to get some more information in a really sick dog, I think that it can potentially be very useful. But because you can't rule it out with a negative, and you can't necessarily make a diagnosis in a vacuum based off of a positive, you have to also submit your standard testing. You
Yeah.
have to. But it is,
Are those clinical trials still going on?
yeah, so that test, that study is still actively enrolling. And so, if you have a case where you're suspicious has pulmonary valley fever, let me know. They can't be on azoles for more than 7 days before getting enrolled. One of
Okay.
the pros of having a dog in that study is that owners will get free valley fever testing at their standard 3-month testing. And so I will drive to the clinic and I will pick up the serum sample and submit it through my lab to have testing performed at no cost to the client.
Nice. Yes. And I'll post your email in the show notes below so that anyone that has a dog that they think could enroll in this clinical trial, we can do that.
Yeah, and then the other study that I'm currently in the process of writing the manuscript, I think has some really exciting results. And so, right now there are no evidence-based recommendations for how to monitor dogs with valley fever and when to determine when they're in a remission and when you can stop therapy, right? Everybody has their own
Wow.
anecdotes. Experts have talked about different things that they recommend, but there have been no evidence-based studies to actually show guidance in this area. And so we completed a study focusing specifically on dogs with pulmonary valley fever. And so this study included 31 dogs. And so in this study, we had dogs come back every 3 months until they went into remission, or for a maximum of 12 months. And so our criteria for determining whether a dog in that study was in remission was that they had to be completely asymptomatic. They had to have resolution of their thoracic radiographs or very mild static changes compared to the previous 3-month visit, because we know that some dogs with pulmonary valley fever will have some scarring and they'll have permanent changes like a mild interstitial pattern or a mild bronchial pattern. And so that was okay as long as it was static, but most dogs ended up having resolution, and they had to have IgG titers that were 1 to 8 or less, and IgM was negative. So the very first 3-month visit, where all 3 of those criteria were met, the dogs were in remission. We stopped therapy, and then we followed up with those dogs once every 3 months for a 1-year time period to see if they ever relapsed. And so in that study, we had 3 dogs go into remission after just 3 months of therapy. We had 7 dogs that went into remission after 6 months of therapy. Then we had 10 dogs go into remission after 9 months of therapy. And then most of the dogs ended up going into remission by that 12-month recheck, although there were 5 dogs that ultimately didn't go into remission because they didn't meet all 3 criteria. And so I found it really interesting that roughly 50% of dogs had complete resolution of all of their clinical signs by the 6-month recheck. And if you look at the numbers, roughly 60% of them or so were in remission by the 9-month recheck. And so
Nice.
those results, I think, do kind of mirror what the infectious disease COXI guidelines are for people, where
Mhm.
usually most treatment is, if anything, 3 to 6 months. And so I think that for a very long time, as clinicians, we have probably overtreated many dogs for a long, long time because of the ambiguity in what we were using to help decide whether they were in remission or not. Now,
Yeah.
in our study, we did have 3 dogs that did relapse at some point. Um, Having that about 10% relapse rate is an acceptable type of rate when you're talking about systemic invasive kind of fungal infections, whether you're talking about histo, blasto, any of those types of fungal infections, a 10 to 20% relapse rate is, pretty common. And so we didn't have enough dogs to determine whether there were certain variables that were associated with relapse. But that was a pretty low number in terms of relapse. So, that is something that I have now indoctrined into how I treat all of my pulmonary cases. That's how I lecture to all of our students during their courses and didactics. And that's what I talk about in all of my valley fever CE that I do. That's the protocol I use.
Do you find it's important to treat just as long as you need to because of the side effects maybe of the fluconazole or the
Yeah.
azoles long term?
Absolutely. And so that's why we came up with this treatment monitoring plan and the criteria for remission so that we don't overtreat, because it is costly. Monitoring is costly. There might be adverse effects. And so, it makes sense that the treatment length is probably much, much more similar to what humans do with pulmonary valley
Yeah.
fever. I'm sure you've probably seen some pets, or I've consulted on dogs that were treated for 7 years with
Mhm.
fluconazole because of pulmonary valley fever, and clinicians were relying on the titer to go negative, and that often never happens in dogs with valley fever. And so, because it was a 1 to 4 or 1 to 8, they just kept treating, even though the
Yeah.
dog was completely asymptomatic. So that's a risky endeavor. And so I really
Yes.
hope that once I get this study out, that'll really help a lot of clinicians and their pets.
Yeah. It's risky for the adrenal glands too, because
So,
the
so ketoconazole, yes. Other azoles don't affect sex steroid production, but ketoconazole absolutely can make them Addisonian. But fluconazole, itraconazole, those don't affect cortisol production.
okay.
And then
Good
I
to
know we only have a couple minutes left. I just wanted to do a quick plug.
Okay.
I do have a couple other studies. So we are looking at the IMI point of care test in cats. So any cat out there that a clinician has a patient that is either newly diagnosed or they're
Nice.
in the process of treating them, I can perform free testing for them. I just need a little bit of serum. And so I'll drive to your clinic and pick up the serum. I'll do free testing for your client. And then I'll be able to use a little bit of the extra serum to run the MA test for the cats.
Fabulous. That our cats help too.
Yes, exactly.
Wonderful. That's great to know. Thank you, Dr. Jaffe. So
Yeah, absolutely.
I will put your email below in the notes, and if you have links for the test, the IMI
Yeah,
test for cats, I can put that in the notes below for everybody. So
awesome.
they're aware of the clinical studies going on, and this has been so helpful. Talking about testing and your research. This has been wonderful. Thank you so much for your time.
Yeah, my pleasure. I always love talking about valley fever, so I appreciated the invite.
Okay. Thank you, Dr. Jaffe. We'll
All
talk to
right.
you.
Yep, take care. Bye-bye.